Hi, my name is Rebecca Staples, and I am going to talk to you about multiple sclerosis. That's the topic that I chose, a condition of the central nervous system. What is MS? MS is a chronic illness, which can also be referred to as an autoimmune disease. It attacks your central nervous system, your immune system, attacks the myelin sheath, which is a protective layer around your nerve fibers. This causes inflammation in scar tissue or lesions. It can make it hard for your brain to send signals to the rest of your body to do pretty much anything. There are 4 types of MS. The first one is relapse remitting, which is the most common. The second is secondary progressive MS. This is where the symptoms steadily get worse over time, but there is bouts of remission, which is where you go without any symptoms at all. Then there is primary progressive MS. This is not very common. It only affects about 10% of the people who have been diagnosed with MS. And then there is progressive relapsing MS, which is rare. It only affects about 5% of the people who have been diagnosed with multiple sclerosis. Symptoms. There is no cookie-cut checklist of symptoms for people with MS. But the most common ones are vision problems or impairment, which usually happens in only one eye. And that can go from blurry vision to double vision to almost not being able to see out of one eye at all. Tingling and numbness of the limbs, again, that usually only affects one side of your body, mostly because of where the lesion has showed up on the brain, of what part of the brain it has showed up on when it is active. And unless you have 2 lesions on the same 2 spots on your brain, will you be affected in both legs or both eyes or both arms. Difficulty walking, slurred speech, memory loss, depression, problems with sexual, bowel, and bladder function. Diagnosis. So there are a couple of ways you can be diagnosed with MS. One is a blood test, and that usually just helps rule out all the other diseases that have symptoms similar with MS. And then there's a spinal tap. A small sample of your cerebral spinal fluid is removed from your spinal canal to be analyzed in a lab. And then there's the good old MRI. And that can reveal the lesions that are on your brain and your spinal cord or even your cervical spine, because that's the playground for MS. That's where it likes to hang out and cause trouble. And with an MRI, you sometimes will be given an injection called a contrast, and that will help show for the MRI where the lesions are active, which means that usually when you have an active lesion, you are experiencing some kind of symptoms. And then the last is an evoked potential test. It records electrical signals produced by your nervous system in response to stimuli. And for lack of better words, how quickly information travels down your nerve pathways. Because, as stated, MS attacks your nerve endings from your brain to your brainstem. So eventually, once the myelin sheath has been too damaged, it's almost kind of like having a pothole in the middle of the road, you can't go. So for treatment, sadly, there is no cure, but the medical field is constantly advancing. Now, for example, if you are currently experiencing an attack, you will be given Prednisone, which is a steroid, or you can be given intravenously the steroid, and that is prescribed to reduce nerve inflammation. Now, for a patient who does not respond well to or at all the corticosteroids, they can be given a plasma exchange. So on this slide, this is treatment for modifying the disease or trying to control the progression of the disease. So there's injectable treatments. They can be injected under the skin or into the muscle. Interferon beta medications, Capaxin and Glotopia, and that helps block your immune system attack on the myelin sheath, and that must be injected beneath the skin. And then there's oral treatments such as pills. The only one that I can pronounce is Tecfidera. I probably didn't even pronounce that right. But you have options for those, and then there is infusion treatments. The one that I'm most familiar with is Ocrevus, and then there's Tysabria, and then the other one. And infusion treatments are usually done in some sort of infusion lab, and they're intravenous. And this is me. During my first Ocrevus infusion. I think that was like 2 or 3 weeks ago. But I was officially diagnosed on March 4th, my daughter's birthday, which was sad, but you know, the show must go on. I chose this topic because it hits really close to home. And, you know, when I knew that I was taking the psychology class, I was I need to take it for the degree, but I also was more, I guess, invested in it because it's like, okay, this isn't just words and I have to remember and learn, like I can actually gain some good knowledge, so that when I do have to go to my neurologist, I can better understand what she's saying to me, because at first I was just like, and a what and So, I am I am enjoying this class. For lots of reasons. I love learning, but also, so that I, can understand what I'm being told and not having to listen and then Google and then still not understand. So thank you, Miss Shine. I appreciate that. And then I made a little extra bulletin on the slide that says I'm here to tell you the brain fog is real, because it is. There are lots of times when I am trying to talk or tell a story, or I'm usually fussing at my kids and I'm starting to like nag and rant, and then like I can't remember the word for the trash can. It's a trash can, but for some reason it's like the thing that you put the thing in. So God love them. They kind of become my interpreters. They got to figure it out, because sometimes Mama can't find the words, but I eventually remember the word. And then take your vitamin D and drink your water and be grateful for every day you wake up, because every day is a blessing. And these are my references that I used for some of the slides. And thank you.